through this at some point. After the common cold, ear infections are the most frequently diagnosed childhood illness in the United States. Most kids will have had at least one ear infection by the time they're 3 years old. And your little Peach has one right now.
Oh, she's a peach. My little Emma, she went to the doctor yesterday and she has an ear infection. I had to stop and pick up some antibiotics on the way home from work yesterday for her. So how can you reduce the risk of your kid getting an ear infection? Too late for us, but we want to help you guys out. Kristen Woodward is here to answer your health questions. I mean, can you reduce the possibility of getting it in the first place?
Great question. You can reduce the possibility of getting ear infections. The first thing we really recommend is that you breastfeed for the first 6 months. That decreases not only ear infections, but other types of infections as well. And then one thing we don't think about with ear infections, but your immunizations, making sure your kids' immunizations are up to date, because one of the immunizations called Prevnar, it decreases the risk of a certain type of bacterial infection that causes ear infections. And then the flu vaccine. The flu virus can cause ear infections in kids, and then, of course, decreasing secondhand smoke.
I didn't know that about the immunization point you made. That's pretty
interesting. She knows all this stuff like she's a doctor or something. Imagine that.
She has a giant ear, so she definitely knows. Can you kind of explain the pathology of the ear here so we know what makes the children's ears so susceptible? They have parts of their ear that don't work the same way as ours.
Exactly. So in kids under the age of 4, they're much more susceptible to ear infections than older kids, and that's because of something called the eustachian tube. Now, the eustachian tube helps drain fluid from the middle part of the ear. That's where the ear infection develops. In kids, this eustachian tube is horizontal, it's thin, and it's floppy. So it's much harder for fluid to drain out of the middle ear with the smaller, floppier eustachian tube, and that's what increases the risk of an infection and why we see it so commonly in kids.
It's made up differently. And so, you know, once the kid gets the ear infection, kid starts crying. My daughter woke up crying, her ear was hurting. We went right to the ibuprofen, the children's ibuprofen. Is that the right course of action? What should you do as a parent?
That's exactly right, because we know that first 24 hours is the most pain that they have. And so you absolutely want to use, I like ibuprofen or acetaminophen, which is found in Tylenol. Treat the pain, get that under control, especially babies. You know, they can't say their ear hurts, so they often tug at their ear or they bat their ear. They're irritable, they're fussy, they might not want to eat, they have low-grade fever associated with cough and cold symptoms. And then you go in to the pediatrician. This isn't something that we can diagnose over the phone. We have to look into the ear, make the diagnosis, possibly prescribe an antibiotic. And then we know that there's those kids that are going to have recurrent infections. They have more than 3 infections in 6 months or more than 4 in a year. And then we put a small, tiny tube into the tympanic membrane or the eardrum, and it helps drain fluid the other way. But those are extreme cases.
Well, Dr. Woodward, we know you get it. You had tubes in your ears when you were a little one, so we know you're sensitive to it. You can find more info in the Colorado Parent Family Health Issue. It's on newsstands now.
Doctor, thank you so much. Always a pleasure to have you in here.
Great to see you both.
There's lots of good info. We appreciate that. Let's get over to Greg. He is watching your weather. The changing weather never helps with kids.